and welcome to our exciting new series, Katz Conversations, where you'll get to know our Katz Institute for Women's Health clinicians on a deeper and more personal level. I am Alexa Tiven Sanfilippo, and I am thrilled to be joined by our Katz Institute for Women's Health clinician member, Dr. Margaret Andersen, internist who specializes in women's health, medical director for ambulatory quality in the Western Northern Subregion, and assistant professor of medicine for the Zucker School of Medicine. Welcome, Dr. Andersen.
Hi, Alexa. Thank you for having me.
Of course, we're so excited to have you today. So the first question we wanted to ask you is, what drew you to the field of internal medicine?
So I'd have to say, honestly, my love of science, human physiology was sort of the impetus for me to pursue medicine. My family is really more law enforcement, firefighters. My dad was a New York City fireman. My grandfather was a New York City fireman. So for me to choose medicine was a bit unconventional in my family, but I decided to become an internist, mostly because I really wanted to provide comprehensive care, to really care for patients in a very holistic way. So after finishing my training as an internist, I was in private practice for several years. And what I noticed over time was that the women in the practice tended to gravitate towards me versus my male partners. And I started to really notice that there was clearly some differences in the way women presented, the way they perceived their health, the questions that they had, things that I could really relate to. So about 20 years ago, I joined with Dr. Nancy Barron, and the two of us started an internal medicine practice for women. And at that time, there really was not a whole lot out there about women's health. We did our research, we went to lectures, we went to seminars, and what we found was it was really mostly around obstetrics and gynecology. So we were both thrilled to join Northwell and the Katz Institute, because here we found physicians, other providers that really felt the same way we did, that there was such a need to look at other parts, cardiology and endocrinology and, all the other aspects of women's health. So this has been, incredibly rewarding and a journey to get here, but I'm really happy.
Wonderful. Thank you. What would you say has been the most rewarding and challenging experience so far in your career?
So I think probably rewarding and challenging at the same time, I would have to say, would be the transition that I've had to make from being a full-time clinician, seeing patients, to a part-time provider and a part-time medical director. These are, administrative roles are not something we learn in medical school. So there was a lot for me to learn. I was really very fortunate to be able to participate in the physician leadership development program, which was incredible. It really provided me with a lot of the knowledge to be able to take on a role like this and to meet so many of the leaders in our health system who were, there for me to provide guidance and advice.
Great. Yeah, I love that your most challenging experience was also your most rewarding. I think that's wonderful to hear. Okay, so what are 3 takeaways you want women to know to improve their health?
So I would have to say these are things that I talk to my patients about a lot. The first, I think, is the importance of preventive medicine. So I encourage all my women in my practice to come for their wellness exam, schedule an annual wellness, because it's such a great time to sit down and talk about risk factors, things that we can change and things that we can't change, like our genetics. So going through that, going through all the things that really need to happen for better health. So that would be the first thing. The second thing that I often talk to my patients about is knowing your numbers, because that's also a very individual thing. Some things are across the board. We all want to have blood pressure less than 120/80. But there are other things that aren't as straightforward and take into account other risk factors, like cholesterol, for example. So for your cholesterol, it's not just the number. It's your individual number because it takes into account whether you're a smoker, whether you're a diabetic, whether you have high blood pressure, family history. All these things come into account. So knowing all your individual numbers where you should, I think, provides a real guideline as to what you want to achieve. And then the third thing that I often talk to my patients about, probably all the time, is the importance of exercise. So I tell my patients, have a goal. And the goal that I can provide them with is really based on research. And that is 150 minutes of exercise, moderate intensity exercise a week. And one of the things that comes up often is women particularly will say, I work Monday through Friday. I come home, I have to make dinner, there's homework, there's all this stuff that needs to get done during the week. And now, as of this year, earlier this year, there was a big study that was released. It was about 90,000 people that they studied. And what they showed was that 150 minutes can be achieved just on the weekends. Like, you can be a weekend warrior, so I can say to them, look, there's real good evidence for this. It's okay Monday through Friday when you're busy, but get those 150 minutes in on the weekend and you'll achieve the same cardiovascular benefit than you would if you'd spread it out throughout the week.
That's great. When you said 150 minutes, I immediately thought those Monday to Friday jobs and all those things, but it's good to know you could do it all on the weekend too. Okay. So what's the big thing coming down the horizon in your field?
I would have to say the big thing we're talking about now is weight loss medications. So, and we're all hearing it's all over the news, but I think it's really exciting as a primary care doctor. These medications that have come out, the most recent one, tirzepatide or Zepbound, was just FDA approved just very recently, really shows incredible promise. And I think to be able to have these medications as part of an arsenal to combat weight loss and to provide an alternative to surgery. In the past, I was referring a lot of my patients who were unsuccessful, with diet and exercise for surgery. That was the only option. But now we have some really good options, and it's going to continue in 2024 because some of these medications are going to be in pill form. And then there's ones that are now a combination medications. Well, tirzepatide is a combination of two, but there's another one coming on the market in 2024 that's a combination of three. So being able to achieve weight loss, I think right now is probably the biggest thing in primary care.
What challenges have you faced in the health system so far in your career?
So I would have to say that this is definitely a challenge, but it's not unique to our healthcare system, and that is obtaining access to better mental health care. It's something I think about all the time. I screen women in my practice for depression, for anxiety, at least once a year, sometimes more if needed, and we see it a lot. And the resources are not always there. I think that Northwell has done a really good job at recognizing it. I think that there are some great things available. I think we have a lot more to accomplish. In my practice, we do collaborative care, and I know a lot of other practices do this as well. And we have a behavioral health counselor that works with me, and along with a psychiatrist who provides input when needed. And I think that's wonderful. I think that's been great. And we've been doing that for the last couple of years. I think the behavioral health center at Zucker Hillside is just amazing. I think the commitment to the adolescent and child facility at Cohen is going to be wonderful. So I think there's a lot of things that are going to happen, and I think it's really exciting. I just feel that we still have a long way to go.
All right, this is one of my favorite questions because I think everybody always wants to know how to do this. How do you manage your work and life balance?
So that's a hot topic. Everybody
Yes.
talks about that, right? So I think that that's somewhat of an individual thing, because that means different things to different people, right? At different stages of their lives. For me, it's always been, my family has been a big priority. And having quality time with my family is really always what I try to achieve. When I talk to younger doctors, when I talk to students, and we talk about this, I usually give them a couple of pieces of advice. The first is work efficiently as possible. So, learn how to be efficient in your workday. Learn those things that you can do to make your documentation efficient. Learn the EHR, seek out help in making yourself more efficient so that at the end of the day, you can close your laptop, go home and be with your family. So, and it takes work though. It takes work to get there. The other thing is, I think making the time, choosing whatever, at first, each person, it's something different. Choosing, something that you enjoy and scheduling it, not just say, oh, this is something I want to do, but actually making a schedule so that you can do it. Carve out the time. I know for me, I play pickleball every Wednesday night, and that's my time. Like that's, I have a group of women I go with, and my husband knows, he gets dinner ready on Wednesday nights because that's my time. So those would be my biggest pieces of advice as far as work-life balance.
Great. Thank you for sharing. Okay. So how do you practice medicine in an integrated way?
So, as an internist, I really do practice evidence-based medicine. I really am pretty conventional when it comes to how I practice. But I think the way I practice integrated medicine is really listening to my patients, because people have different things that provide them better health, whether it's yoga, meditation, acupuncture. So as a healthcare provider, I need to be open to all those things, but I also need to be a source of information, a resource for my patients. So what I do and how I consider myself practicing integrated medicine is I learn about what's available in my community. So when a patient comes and I think that, hey, they may benefit from acupuncture, I can refer them to someone who can help them. So for example, our hospital is Northern Westchester Hospital up here in Westchester, and every Friday they have Meditation Friday. And it's for patients with cancer and caregivers. So if I find the right patient and it would be appropriate, and that would be something that would provide better care than what I can give, I can make that recommendation. So that's how I consider at least my view of integrated medicine. And I think it's important. I think, addressing, the mind, the spirit, I think really is all part of good health.
Right. Thank you. Okay. So now we're going to do some rapid fire questions. So I'm going to ask a few questions. I just want you to say whatever's on your mind. All right. So
Okay.
the first one is, what's your guilty pleasure?
Oh, guilty pleasure. I would have to say cannolis from Arthur Avenue.
Okay. I love that.
And anybody goes down to Arthur Avenue, I would say, bring me a cannoli.
That's great. Well, okay. So the next question is, what's your favorite food? Would that be it also?
Now that's a guilty pleasure. So
Okay.
I try not to do that too often. So my favorite food, I know this is going to sound kind of boring, but my favorite food actually is salad. I love salad. So whenever I go out, I always order a salad, whatever it is. That's just my thing. I'm at Chopped all the time also.
Chopped is great. All right. What was the last great book you read?
So I'll have to say it's definitely an older book, and it's a book I've read many times. So I read it again recently, The Red Tent by Anita Diamant. It's a biblical story based loosely on, because we don't know the whole story, on Jacob from the Bible and his wife and his daughter and her sisters. And it's all about the interaction of all these women and how they drew strength from each other. And it's fascinating. I love that. That's one of my favorite books.
Okay. What do you hope your legacy will be?
Oh, that's an interesting one. Legacy. Honestly, I think that because I've been practicing for a long time in the community, and I have taken care of grandmothers and mothers and daughters. I hope my legacy is that I provided good care for the community and that I was part of people's lives, because I really do feel that I am. It's kind of simple, but
I think that's wonderful. Okay, what's your favorite movie?
oh, definitely. It's an old one. Lawrence of Arabia. Love Peter O'Toole in that. I will tell you, it's a big commitment to watch that movie, though. It's like 4 hours, if not more. An all-time classic. I love movies based on history. I love when there's a historical component to it.
Yeah, it's nice to be able to feel like you're learning something too. And yeah.
Mhm.
Okay. And the last rapid fire question is, are you a sweet or salty person?
Well, I did say cannolis, so that's sweet. But I will say I really do like salty too. I love a big bowl of popcorn and a movie. That's that's me.
I agree with you. All right. Well, Dr. Andersen, it was so wonderful getting to know you. Thank you so much for being here with us today. So we wanted to thank everybody for taking the time to join us and learn more about our Katz Institute for Women's Health Clinicians. And we want you to not miss our next Katz conversation. So thank you.
Thank you.